Good morning, everyone. Thank you for coming today as you will be learning about Broca's aphasia. First, I'm going to introduce. Good morning, everyone. Thank you for coming today as you will be learning about Broca's aphasia. First, I'm going to introduce some brief terms that you may not know. The first term is language. Language is a system of communication which consists of a set of sounds and symbols. The next term is aphasia. 84.5% of people have actually never heard of the term aphasia. Aphasia is a language disorder, which means it is the impaired ability to communicate effectively with others. Two types of aphasia are expressive and receptive. What is Broca's aphasia? Broca's aphasia could also be called expressive aphasia. Broca's aphasia is a non-fluent aphasia in which the output of spontaneous speech is markedly diminished and there is a loss of normal grammatical structure. This means when a person is talking, their output may not be good, but they can understand it. Next, we have some demographics. More people have aphasia than many other common conditions, including cerebral palsy, multiple sclerosis, Parkinson's disease, or muscular dystrophy. Nearly 180,000 Americans acquire the disorder each year, and men and women are affected equally. Next, we are going to be talking about the anatomy of the brain. There are two main parts of Broca's area with different roles during language comprehension and production. The first part is pars triangularis, which is the anterior or the front portion of the brain. Next is pars ocularis, which is the posterior or back part of the brain, near the motor cortex, and it is utilized in speech production. Next, we have the physiology of the brain, or the function of the brain. The primary functions are both language production and comprehension. So the anterior or front portion of the brain is semantics, and the posterior or the back part of the brain focuses on phonology. The second function is that it regulates breathing patterns while speaking, and vocalizations are the required for speech. According to Science Direct, it coordinates the activities of the muscles of respiration, the larynx, the pharynx, as well as those of the cheeks, lips, jaws, and tongue. Broca's area is necessary for language repetition, gesture production, syntax or grammar, fluidity, and interpretation of others' actions. Next is the neurology of the brain. Some blood vessels that are affected in Broca's aphasia also deliver blood to the areas of the brain that control the movement of one side of the body, usually the right side. Broca's aphasia often goes along with other health conditions after a stroke. These issues include hemiparesis, weakness, or hemiplegia, paralysis on the right side of the body, alexia, which is the inability to read, and agraphia, which is the inability to write. So how does this impact Broca's aphasia? It prevents a person from producing speech, words are not properly formed, and the speech is slow and stuttered.
So next, we're going to be talking about some language and speech characteristics associated with Broca's aphasia. So in language, we have poor grammar, short but meaningful sentences, difficulty reading, and difficulty writing sentences. Speech, they may have difficulty repeating what is said by others, difficulty with articulation, and articulation is very important in the clear and precise sounds of speech. They may have apraxia of speech, and just overall, the brain has trouble communicating effectively. Some additional characteristics are right-sided weakness or paralysis of the arm and or leg, and difficulty following directions. So more specifically, the impact on speech and language. People with Broca's aphasia, they have trouble speaking fluently, but their comprehension can still be preserved. So they are usually able to understand what is being said to them, but they have what they want to express in their mind, but when they actually go to speak it, they have difficulties because their speech is not fluid. So this can be very frustrating for the person. They also have trouble producing the right sounds or finding the right words. They have more difficulty using verbs than using nouns. They have difficulty producing and understanding grammatical sentences. And they may be able to read, but be limited in writing. So, like I said before, their comprehension is still preserved, but reading may still be an option for them. So here are some examples. They have difficulty forming complete sentences. So for example, if you say the sentence, Sally went to the store, they may express it as Sally went. They often leave out words. Uh, Mainly it's the words that aren't important, like the words is and the. So for example, in the sentence, there is the cat, it would be said as their cat. They have trouble understanding sentences. They say things that sometimes don't resemble a sentence. They make mistakes in following directions, such as left, right, under, and after. And they use words that are close to what they intend, but not the exact words. So, for example, if they see a truck, they may say car. They may also experience executive deficits, such as planning and organization, cognitive flexibility and shifting, and self monitoring. In addition, semantic processing. So if a word or sentence is grammatical or too complex, they may have trouble understanding or expressing that. They also have trouble with the verbal short-term memory, working memory, and long-term verbal memory retrieval. Um, they may not remember what was being said to them, so they may ask to have things repeated multiple times. So some of the research studies that have been conducted, there has been a small body of research documenting some patients with Broca's aphasia to have impairment in visuospatial working memory, which is used for, cognitive tasks and daily life activities. But this is a very small body of research. And then in addition, evidence that recognition of nonverbal information was unimpaired in individuals with Broca's aphasia compared to the recognition of spoken or printed words, such as eye contact, facial expressions, gestures, and posture. Those usually aren't affected as much as spoken or printed words are.
So in terms of the treatment and management for Broca's aphasia, there is no standard treatment. Each treatment should be tailored to the patient's individual needs, as some patients may need more work in certain areas than other patients do. So a team approach is used when treating Broca's aphasia because it's crucial for obtaining the best possible results and ensuring that the patient's needs are all being met. The team will often consist of a speech language pathologist, a neurologist, and a neuropsychologist who work together to develop a care plan for the patient. And the goal of treatment of Broca's aphasia in terms of speech therapy is to restore any lost language abilities, strengthen the communication skills that still remain, and teach strategies to compensate for impairments. It's important to note that the recovery of language skills is usually a relatively slow process. Therefore, it becomes important to start speech therapy early to achieve the best possible outcomes. Speech and language therapy is crucial to providing aphasic patients a means to communicate their wants and needs. And SLPs will often do this by providing patients with a board with various objects so the patient can point to the object that they want. And in some severe cases of Broca's aphasia, augmentative and alternative communication, or AAC, is sometimes used when communication breaks down. And speech therapy is important for improving the person's ability to communicate by restoring as much language as possible, teaching how to make up for the lost language skills, and finding the other methods of communication. Medical treatment is currently under investigation in clinical trials, including various drug therapies that may help improve blood flow to the brain, enhance the brain's recovery or ability to help depleted chemicals in the brain. So with Broca's aphasia, music ability is often spared, and therefore SLPs have begun to use a form of therapy known as melodic intonation. This is a form of therapy in which the SLP encourages the patient with poor speech production to try to express their words with musical tones. And this therapy uses melody and rhythm to improve expressive language by focusing and singing and engaging language capable regions in the right hemisphere of the brain. The goal of this type of therapy is to lead patients from intoning or singing simple 2 to 3 syllable phrases to speaking 5 or more syllable phrases across 3 different levels of treatment. And this approach has shown a lot of promise in clinical trials. To conclude, these are the references we use for this presentation, and thank you.